Welcome to Muscle Research Review for the week of July the 20th, 2015. Quick research summaries for the very busy health and fitness professional. So let's begin. Now, we've always stressed how a clinical examination needs to take all tests into consideration before making a diagnosis. An interesting new study looked at the effects of chronic shoulder pain on maximal force of shoulder abduction. Now, the study compared 14 subjects with unilateral shoulder pain to 11 healthy subjects. They tested maximal isometric force at 30 degrees of arm abduction. The results showed that there is no statistical difference in isometric strength between the two groups. In addition, they found no difference in activation of the serratus anterior, middle deltoid, and upper trapezius either. Now, it just goes to show you can't always rely on one test or functional outcome to base our treatment success on. Now, continuing with the shoulder joint, if you're seeing someone with subacromial impingement, this new study found the shoulder motions that cause subacromial impingement. Now, they took 16 healthy subjects and evaluated the vertical displacement and peak strain of the coracoacromial ligament by ultrasound imaging. Now, here's what they found. The highest vertical displacement and peak strain was during forward flexion, horizontal abduction, and internal rotation at 90 degrees. These are the motions to watch out for if your patient or client has impingement syndrome. Now, does this change in any way the exercise you're currently prescribing? If you're prescribing your clients or patients row exercises, here's a great study to look at the effects of performing bi- and unilateral row exercises on core muscle activation. The study used 15 resistance-trained men. Here are the results that may help you match the right exercise with the right goals. Free weight row provided greater EMG activity than machine row for erector spinae and multifidus. Unilateral performance of exercises activated external oblique more than bilateral performance regardless of the exercise. And bilateral performance of exercises provided greater erector spinae and multifidus EMG compared to the unilateral. Want to activate the back? Use the bilateral rows. For external obliques, progress to the unilateral. Now, we've discussed training under blood flow restriction before. This is a novel training method that may extend into rehabilitation in addition to training. However, how much blood flow restriction is necessary? That's where the study comes in. They looked at the influence of relative blood flow restriction pressure on muscle activation and muscle adaptation. 14 individuals completed elbow flexion exercises with pressures from 40 to 90% of arterial occlusion. For the acute changes, decreases in torque were similar between the two groups. For chronic changes after 8 weeks of training, results were also similar. Incidentally, there was an increase in muscle size, peak isotonic strength, peak isokinetic torque, and muscular endurance. Now, results show that the lower arterial occlusion of 40% worked just as well as the 90%. As we had recommended in a previous video review, we're looking forward to more studies on proper doses and specific protocols. This study helps us move down the path from theory to real-world practice. If you have any comments, leave them below. Also, make sure you subscribe to our YouTube channel. We'll see you guys next time.